Hi, I'm Julie Hampton, and I'm a nurse practitioner student with Maryville University. Here today to do a head-to-toe examination with my volunteer patient, DH, aka David. We have asked him to empty his bladder and to put on some comfortable clothes for examination. I've also done a near vision test with the Rosenbaum exam and a distant vision test with the Snellen exam. We've taken a full set of vital signs and done height and weight. We're going to go ahead and get started with the head and face. First, starting our assessment with inspection, looking at the skin, looking for any discolorations, looking for any visible trauma, looking at the shape of the head as well. It's normal cephalic. I'm also looking at features, making sure that they are symmetrical and that they are symmetrical on rest, movement, and expression. And that all looks really good. I don't see any edema, erythema. We're going to palpate now, palpating the facial bones. No tenderness on palpation. And I don't feel any crepitus or swelling. I'm going to go ahead and palpate over the orbits, also for increased pressure, and the eyelids for nodules. And no tenderness on palpation there either. I'm going to test the temporomandibular joint. I'm going to have David open and close his mouth. Feeling for any clicking, popping, locking. The joint should move symmetrically on both sides smoothly. One more time. And it does. Feeling over his sinuses. I shouldn't feel any increased fullness there. And his frontal. And I notice no tenderness on palpation as well. Okay, we're going to move on now to the scalp. And the scalp should move smooth and freely. There shouldn't be any nodules, any projections. I'm also looking at the hair. He does have male pattern baldness, which is a normal finding in this patient. I'm looking at color and texture of the hair as well, and that looks fine. I'm going to go ahead and do some lymphatic exam now, starting with occipital. Look for any nodules, any swelling, preauricular, postauricular, anterior cervical, deep cervical, posterior cervical, and tonsillar, submandibular, and submental. And those are all great. Okay, we're going to go ahead now and move on to the eyes. And I'm looking at the exterior characteristics of the eyes. I notice that the eyebrows are full and even and do extend past the eye. The palpable fissures are not small or a normal size. And I'm looking to see that the eyelashes are growing out and up, and they are. I'm looking if there's any lesions, any nodules that I can see, any drainage, and I do not see any. We're going to go ahead and use our pen light to look at the conjunctivae. Go ahead and look up and to the left, and up and to the right. Good. In a second. Nice and pink and moist. There's no drainage there. There's no plaques or lesions. Also looking at the sclera for a nice white color, and we do have that present without any green tinge, yellow tinge, any plaques that I can see. So that looks good. We're going to move on to pupil response, both direct and consensual. I'm going to start with this side and have David look at a fixed spot on the wall. And move it to the left, direct. And the right, direct. The left, consensual. And the right, consensual. And those are equal, reactive to light, and symmetrical. We're now going to do some extraocular movements, checking cranial nerves 3, 4, and 6. I'm going to have you look at the end of my pen light. Show this in the middle there, because I'm not right in front of you. And without moving your head, I want you to follow the tip of the pen light and let me know if you see anything double. Okay. Across. Down. And that is intact. Okay, next thing I'm going to do, David, is have you do the cover uncover test. You're going to look again at that fixed spot on the wall, and you're going to cover one eye. I'm looking for any ocular deviations, and now the other eye. Okay, great. And we're going to check for your red reflex. I'll get my ophthalmoscope. Make sure I have it in the right position. Look straight ahead, please. There's the red reflex. And that is present. Okay, we're going to move on to the ears. First thing I'm going to do is inspect the ears on both sides. Make sure that I do not see any drainage, any lesions, any skin discolorations, any deformities. We're going to palpate the ears. Make sure the auricles are nice and pliable without any nodules. And that looks good. We're going to go ahead and get our otoscope. Take a look inside. Okay, pulling the auricle up and back. I'm going to take a look. Turn our light on. Tympanic membrane is pearly gray. It is not bulging. I do not see any erythema. I see a little bit of cerumen and some terminal hair, which is a normal finding. And that looks good. No drainage noted there as well. Okay, I'm going to take a look on this side. Auricle up and back. And tympanic membrane is pearly gray. I do not see any bulging, no erythema, no drainage, a little bit of cerumen and some terminal hair present, and that is normal. Next, we're going to look at the nose. Just inspecting the nose, seeing that it is midline, looking for any obvious deformities, discolorations, lesions, and I do not see any. I'm going to go ahead and look inside the nose. Looking at the mucosa, it's nice and pink. The turbinates are not enlarged. Septum is not perforated. It is midline. Same thing here. Also noting that there are no polyps to either side. Okay, David, I'm going to go ahead and have you cover one side of your nose and breathe in out of the other side. We're checking for patency of each nair, and that's there. All right, we're going to move on to the mouth. We're going to move on to the mouth. I'm going to have you open your mouth. I am looking at the lips, making sure that they are moist. There's no cracking or lesions noted, especially looking at the corners of the mouth for cracking. We're going to look inside the mouth, looking at all the mucosa, and that all looks good. Underneath the tongue, on the sides of the tongue, wonderful. Looking at the soft and hard palate, there's no lesions, no discolorations, no plaques, no increased erythema. It's all nice, pink, and moist. The teeth were ivory with a normal amount of teeth present, no decay or loose teeth there. I'm going to go ahead and have you, the tongue is nice and pink with normal rugae as well. Go ahead and say "ah" for me. Ah. Okay, great. Testing cranial nerve number 9. The uvula is moving smoothly and symmetrically, as well as the small palate. Okay, we're going to go ahead at this time and we're going to do a quick hearing test. This is the Weber test. I want you to tell me if you hear this in one side of your ear or in both. Both. Okay, good. And now we're going to do the Rhine test. I want you to tell me when you do not hear that anymore. No. Okay. And again, same thing. No. Okay, and that air conduction should be twice as long as the bone conduction in this test. Okay, we're going to do that again on this side. Okay.
No.
Okay, wonderful. Okay, now we're going to do the whisper test. I'm going to have you cover this ear for me. I'm going to whisper some letters to you and you're going to repeat those back.
A, B, C, D.
Okay, and now the other ear.
P, Q, R, S, T.
Wonderful. Okay, and now we're going to check, that's checking cranial nerve 8, by the way, and then we're going to move on to test some other cranial nerves. First thing we're going to do is test cranial nerve number 5. I'm going to have David clench his teeth for me. Wonderful. And now moving on to cranial nerve number 7. I'm going to have you raise your eyebrows, okay, and squeeze your eyes shut, okay, and smile for me, and puff out your cheeks. Okay, I'm checking cranial nerve number 12. I'm going to have David stick out his tongue and move it from left to right. Perfect. All right, that's wonderful. Okay, we're going to do light sensation test. Okay, I'm going to have you close your eyes and tell me when you feel this. This is also cranial nerve number 5. Do you feel anything?
Yes, top left.
Okay.
Top right. Left cheek. Right cheek. Right chin. Left chin.
Okay, and that is a good finding. Okay, we are going to now move down to the neck. First, inspecting the neck, looking for any fullness in the neck, looking that the carotids are, there's no pulsations there or any jugular distension. And I'm looking all the way around to make sure that the neck is symmetrical. I don't see any lesions, discolorations, or trauma. I'm going to go ahead and palpate now. Should feel smooth. And it does. And I am going to feel that your trachea is in midline, and it is. I'm now going to feel for tracheal tug. There's no tugging there. I'm going to see if I can feel your thyroid gland back in there. Your thyroid is not palpable. If it was palpable, it should not be enlarged, and it should feel firm and smooth. Okay, I'm going to assess your carotids. I'm going to palpate them each separately. Okay, and that's great. They're 2+. Okay. I'm also going to auscultate your carotids and your thyroid for bruise. Go ahead and hold your breath for me. All right, you can breathe normal. And I do not hear any bruise. Okay, I'm going to have you remove your shirt at this time. And I'm going to have you turn around so we can see your back. Okay, first thing I'm going to do is inspect the back. I'm looking for any lesions, discolorations, deformities again. I'm also paying attention to the respiratory effort, the configuration of this region, and I do not see any labored, uneven breathing. That all looks good. We're going to palpate now. And I want you to say 99, palpating for vocal phlebitis.
99.
Or tactile phlebitis, excuse me.
99. 99.
Okay, great. We are now going to percuss. Just percussing in a symmetrical pattern, listening from left to right, any hyperresonance. And it all sounds good. I'm going to have you take a deep breath and hold it in. Okay, and now blow it out. Hold that for me. Okay. And this should be no more, you can breathe normal now, no more than 3 to 5 centimeters. And we have 3.5 here on the right. And we're going to do the same thing on this side. Okay, take a deep breath for me and hold it. Okay, blow it out. Deep breath, blow it out and hold it. Okay. 3 to 5. Wonderful. And that is an equal symmetrical measurement. We are going to also, since we're back here, I'm going to palpate his spine. Looking for any crepitus, any abnormalities, obvious trauma, and tenderness to palpation. Do you feel any tenderness?
No.
Okay. I'm going to percuss. I'm going to do it this way. Percussing over the costovertebral angles. Any tenderness?
No.
Okay, looking at movement of his breathing. Okay, just breathe in deep. Noticing that my thumbs are moving apart symmetrically. Go ahead and breathe in and out. Okay. Wonderful. Okay, we are going to go ahead and listen to your lung sounds. From side to side, deep breath, in and out. Okay, comparing the sides, looking for any adventitious sounds. Good. 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 One more each side. Okay, wonderful. Okay, David, I'm going to have you go ahead and turn around for me.
All what? Breathing.
We are going to go ahead and inspect the anterior chest and lungs. Moving on into the heart exam as we examine this whole area. First, I'm going to look at inspection. Again, I'm looking at the skin for any abnormalities, discolorations, obvious deformities or trauma. I don't see any lesions. I don't see any abnormal vascularity. I'm also looking at respirations, noting that the movement is equal, unlabored, symmetrical, and I see all of that looks really good. We're going to go ahead and palpate now. And again, tactile firmitis, I'm going to have my patient say 99.
99.
Okay, and that is present and normal. Okay, I'm now going to I'm now going to percuss my patient. We're just going to move side to side. Listening for any hyperresonance. And I'm going to have you lift both your arms up to your sides right now. We're going to do the same thing here. And put your arms down. I'm now going to auscultate lung sounds. Go ahead and breathe it out for me. I'm moving from side to side, listening for any adventitious sounds. I hear normal birth sounds. No rhonchi rills. And raise your arms for me. Here. Okay. Good. And again. I'm sorry, one more time. All right, and put your arms down. Okay, so now we're going to move into the heart exam. I'm going to palpate. Well, first I'm going to inspect. I'm looking for any pulsations, heaves, or thrills. I'm going to palpate the precordium. Look for any heaves or thrills, pulsations. I do not feel any. Also feeling for the apical pulse. Okay, and that looks good. I'm going to go ahead and listen to your heart sounds. We're going to start here with the aorta, pulmonic, Herb's point. I'm listening for rate and rhythm. Listening for extra sounds other than S1, S2. I'm hearing a nice S1, S2. It's tricuspid. Sit up straight for me. 3. And mitral. And that sounds good. Okay, I'm going to go ahead at this time. I'm going to have you lay down with your head here at the end of the table. And come around the back here. And we are going to do an abdominal exam. My marker. Okay, this as well. Okay, first thing I'm going to do is inspect his abdomen. Looking, of course, at skin, discolorations, lesions, any pulsations I might see. I'm also looking at the configuration of the abdomen, and that all looks normal. I'm going to go ahead and listen now, listening for bowel sounds in all 4 quadrants. And that's present. Good. Good. Okay. I'm now going to palpate the abdomen, starting with light palpation, feeling for any masses. I'm also noting the patient's face, seeing if there's any tenderness to palpation. I'm also going to ask him if he has any tenderness. So we move into deep palpation. Do you have any tenderness with this? No. Okay. Just moving through all the 4 quadrants. Okay. I'm also going to palpate here under the right costal area for the liver. And I do feel a nice smooth edge there. And in this area for the spleen. Okay, I am not able to palpate that. That's not a normal or abnormal finding. And we are going to feel for the right kidney and the left kidney. And they are not palpable. I'm going to go ahead and percuss now. Just listening for areas of hyperresonance, resonance, dullness. Okay, we're going to go in this area here. Listening for splenic dullness. And there it is. Okay, that's good. I'm also going to percuss for the liver span. Mark that. Do my table there for a second. Okay, and this should be no more than 6 to 12 cms. And this is good. Helps if I hold it right. And we have a nice 6 cm liver span there. Okay, we're going to go ahead and have you sit up now and put your legs towards our camera. Want to check your upper extremities. Put this here. Don't forget that. Okay, we're going to check your upper extremities. First, I'm going to inspect and palpate. I'm looking at your fingers, looking for any abnormalities in the joints, looking at the skin for color, feeling for texture, moisture content, warmth, musculature. And that's all there and present. It's nice symmetrical muscle tone. I'm going to feel for the radial pulses. Those are 2+. The radial pulses. This one high for me. Okay, 2+, and that's good. I'm going to test for strength. Now you squeeze my fingers and splay your fingers for me. Okay, and put them back and do it against resistance. Okay, try to push against my hands. Okay, we're going to with your wrists. Okay, and go ahead and flex, push against. Okay, I'm going to have you try and flex your muscle, like up against my hand. Okay, and push against my hand. Okay, same thing here. Flex your muscle, against. Okay, go ahead and raise your shoulders for me. This is cranial nerve number 11, and relax. I'm going to have you do it against resistance. Okay, and now I'm going to have you go chin to chest and put your head back, looking at the sky, and your chin to your left shoulder and your right shoulder. We're going to do that against resistance now. Go ahead and push against my hand. Again, back here. Okay. And there. And that's good. We're going to now move on to checking your brachial reflex. Paying attention to this area here. We want them to be symmetrical, and he has a nice 2+ symmetric finding there. Musculature strength was a grade 5. He moves well against assisted range of motion. So that's good. We're going to move now to the lower extremities, and I'm again looking at the skin, noting the tone of the skin for any discolorations, looking for any vascular abnormalities, any lesions or visible trauma, deformities in the joints. I'm going to go ahead and feel for his popliteal pulses. They are present and +2. Moving on down, I'm going to go ahead and have you actually lay on the table so that I can see any different pulses. Okay. Can you scoot back a little bit so we can have your legs flat? Okay. Popliteal. 2+. Posterior tibial. Dorsalis pedis. Wonderful. And I'm going to have you push against my hands, testing for muscle strength, and push against my hands. Okay. Try to raise up your legs. Okay. And try to lower your legs. Okay. And same thing here. And lower them. Okay. And I want you to push against my hands, squeeze your legs together, push against my hands. Okay, good. and go ahead and sit up and let your legs come over the table. I'm going to test your tether reflex. Okay. Looking for symmetrical findings. Try that one again. Good. And both are 2+. We're going to move here for the Achilles tendon. Good. It's also 2+. I'm going to go ahead and have you do a couple more things for me. We're going to do 2-point discrimination. Then I'm going to have you close your eyes and you're going to tell me, this is what it feels like, you're going to tell me if you feel 1 point or 2 points and where you feel it. Okay?
1 point on the stomach.
Okay. Land it back.
2 points back.
Okay, and then I'm going to have your palm. I'm not going to tell you which one it is.
2 points left.
Okay, that's wonderful. Go ahead and open up your eyes. And I'm going to have you stand up for me. With your back to our camera here. Now we've already percussed and palpated your spine. I'm going to now have you bend forward at the waist. Okay, and then looking now for the spine, making sure that it is nice and straight with no curvature. Go ahead and come back up and bend back towards me with your hips fixed. There we go. And bend to your right and now to your left. And twist to your left and to your right. Okay, and that is a wonderful finding. Go ahead and turn around for me. That concludes our head to toe examination at this time. Thank you very much.